So the next hour is going to be devoted entirely to heart health in women. It is, after all, time for Go Red for Women. So we're going to begin our conversation this morning with just that, a conversation with cardiologist Dr. Jennifer Mirza at Parkridge Hospital. Good to see you.
Nice to meet you.
I'm very glad to have you kind of lead things off, because we're going to be talking throughout the hour some buzzwords like knowing your numbers. For people who are at Go Red for Women this morning, have heart disease in their family, they probably understand what that means, but what are the numbers that we're supposed to know?
So one of the biggest ones that people are talking about now are the blood pressure numbers. The recent guidelines changed. We're used to, we would say that the top number on our blood pressure could be up as high as 140. We now know that that is not actually good enough control, because we can still have issues with heart disease developing, increase in risk of stroke, and so we now have lowered that top number down to be 130. So we don't like the top number on our blood pressure to be any higher than that.
Okay.
80 is the highest that we want to be on the bottom number, and so those are the ranges that we want to stay underneath for our blood pressure.
So 130 over 80 is as high as you want to push it, and that's regardless of age or anything?
Yes.
Okay. In terms, what are other numbers we're supposed to know? Cholesterol, I would imagine?
Cholesterol numbers are very important. Those really go by your risk factors. So that's where being involved with a primary care doctor to know what risk factors you have to determine how low our numbers need to be. For somebody who is at low risk, we say less than 130 on the LDL, which is considered our bad cholesterol numbers. Those are the biggest ones that we usually focus on, because we know that that has such a high risk of developing blockages in the heart blood vessels. Somebody who's had known heart disease, we usually say below 70. So there's also varying ranges throughout that. So that's where knowing what your risk factors are that can increase your risk of developing heart disease, to be able to determine which range you need to be in.
It is not some strange coincidence that we have Go Red for Women every year. Heart disease continues to be the #1 killer of women. It's high. Is it also the #1 killer of men? It's high ranking anyway?
Yes, it is very high. Is one of the leading causes of death in this country. So it's definitely important for not just women, but for also men still in this country, for sure.
So in the conversation with women, you and I were talking a little bit before we got on camera today. You have some heart disease in your family. I have experience in mine. Most of us do. And yet when it comes to knowing the symptoms, one, we still don't always know them, and if we do, chances are we're thinking about symptoms for men.
And most of the description of heart disease goes off of what we have found in men, because it was predominantly seen as a male-type disease process. As we've gone along over the years, we've recognized that women don't always have the typical symptoms that we think of. A lot of people think of that elephant sitting on the chest feeling, chest pain, chest pressure. Women can have those symptoms too, which is something that you don't want to ignore by any stretch. But at the same time, women will sometimes perceive things differently. Fatigue, shortness of breath. Sometimes women don't necessarily have chest pain or chest discomfort, but they have back pain, especially between the shoulder blades. The biggest thing that I have dealt with women is that they didn't have the typical chest pain in the chest wall that they were thinking was what a sign of a heart attack was.
Right.
And so they sometimes would ignore symptoms for sometimes years.
So if you find yourself having any of those symptoms and you go to an area hospital, chances are, because you would consider that to be an emergency, it's important for the doctor to have the patient or the family representative articulate as much as possible about what you're experiencing. But if you feel like there's something wrong, you rely on the patient pushing that, correct?
Yes, I mean, because a lot of these symptoms, you don't always present with a heart attack. Sometimes you're having symptoms we call angina, and those are the warning signs that there's a blockage in a heart blood vessel, not allowing enough blood flow to get to the heart muscle. And so that's where paying attention to your symptoms, being aware of your body, and communicating with your providers regarding those symptoms so that they can be your advocate to get you where you need to be and have the testing done so we can find out what's going on before a heart attack happens.
You mentioned something earlier about with your primary care doctor. You are a very strong proponent of having a good relationship with your primary care doctor, in part because some of these symptoms can be months in the making. Is that right?
Yes. And usually what I do, you know, I see people who've been having symptoms for up to 6 months to a year. And so it's a matter of occasionally these symptoms are very gradual in their presentation. Sometimes they are very sudden and you feel very sick. But the importance is paying attention to your body, communicating with your primary care. I'm very big on communication and being able to communicate with who you're seeing.
I can't talk to you in the area in which we live and not talk a minute about diabetes. There's a big population here that struggles with that, type 1 and type 2. And you said that greatly impacts how you then present with heart symptoms.
So diabetes can sometimes mask our body's normal response to illness. It can, especially in heart disease, it can blunt the normal chest pain. So shortness of breath is a big one that most diabetics will experience with heart blockages. Also fatigue, nausea, vomiting, sometimes cold, clammy sweats. Now, anybody who's diabetic who's experienced low blood sugars, also you can have those same kind of symptoms with low blood sugar.
Right.
You know, so it's a matter of paying attention, and yet again, that communication is so important with your primary care, or if you're already under the care of a cardiologist, communicating these symptoms to make sure that they're being evaluated.
I look at what happened. My father died of a heart attack in 1981. So you move forward now all these years, which is not really that long. The care you can provide as a cardiologist has jumped leaps and bounds. It's really an exciting time, I would think, in your field.
It is, and you know, we have so many treatment options now, between angiogram to determine if there are true blockages, to be able to fix them with stents, or going forward with the big guns of bypass surgery, and then also medical management. We have made tremendous leaps and bounds forward with just the medicines that we can simply use. And so it determines sometimes that we don't always have to do an intervention, a surgery. Sometimes we can simply give you appropriate medicines that will help reduce your risk and help treat the problems that you have. So there's a whole range of options that we have nowadays.
Thank you for educating us as we launch into the hour to come. We're going to talk to survivors. We're going to talk with other doctors who are working in the field, as well as some supporters of 3+ Women, Go Red for Women that want to share their personal stories as well. Much more of this focus on Go Red for Women during 3+U. In the meantime, if you go to parkridge.com, you can find out more about Dr. Mirza's contact information, also listings of symptoms of heart disease in women. We're back with more 3+U right after this.